The exciting news from Myriad this year particularly relates to hereditary cancer testing and the reporting of the development and validation of the latest enhancement really to our flagship product, which is called myRisk, but the enhancement is Risk Score. Risk Score is a combination of genomic information that integrates information from 87 subtle alterations in the genome called SNPs with clinical information modeled on the Tyrer-Cuzick technique. What this enables us to do is for women with a family history of breast cancer who test negative for the 11 breast cancer genes that are part of the myRisk panel to receive a result, a quantification of risk for lifetime risk of breast cancer. So there are a range of different SNPs throughout the genome that influence risk of breast cancer. We know that on their own, many of these SNPs have little or no impact on an individual woman's risk. But in combination, this specific combination of 86 SNPs with specific weightings, we're able to predict with a high level of confidence and accuracy an individual woman's risk based upon her genomic profile, based upon those 86 SNPs.
At what stage in a patient, or not even yet a patient's, a prospective patient's life cycle, would you recommend this test being considered?
Any woman that has concerns about her personal history of breast cancer or her personal risk of breast cancer based upon her family history should talk to their physician about hereditary cancer risk assessment. A woman that has a strong family history of breast cancer who is eligible to undergo genetic testing should consider this. myRisk is now the most comprehensive tool for assessing a woman's risk of breast cancer, either based upon the inheritance of genes like BRCA1, BRCA2, the 11 well-known breast cancer genes, or now based upon her clinical and genomic risk as measured with Risk Score.
And if women do have a number put to their their lifelong potential of developing breast cancer, have there been any considerations of the psychological, the long-term effects of having that number put on maybe even your life expectancy to say, oh, if it's only a 5% chance, someone could quite easily obsess over that, or
Very
maybe
much so. I think different women have different levels of anxiety about their baseline breast cancer risk. Some are valid and well-informed based upon either a strong family history or based upon genetic testing results that they've received previously. Other women have perhaps something of an overinflated assessment, personal assessment of their own risk. And then, of course, there are always those of us in the community that are sort of in that denial phase, despite evidence to the contrary, who believe that our risk of any disease is lower than it in fact actually is. I think it's true to say that most patients feel more empowered with more information. Most patients feel better about themselves if they have a more accurate assessment of their risk of a disease, of any disease, breast cancer included. And so I think our hope is, and certainly feedback from clinicians and patient groups to date, is that the additional incremental risk information that the myRisk test now is able to provide by integrating Risk Score into the process overall enhances a woman's sense of confidence in knowledge of her own risk and empowers her and her physician to change management appropriately according to a more accurate risk.
Okay. And in terms of clinical application, are there any barriers or considerations when it comes to cost or time of application or getting it out to, say, smaller clinics, or is it very centralized in larger hospitals?
So this is, I think it's very important to say that the data we're presenting this year at San Antonio is an enhancement to the myRisk product. myRisk has been our flagship hereditary cancer product for many years now, and the Risk Score tool that's being reported, the development and validation that's being reported this year, is an enhancement to myRisk. There's no incremental cost to patients, there's no incremental cost to the system associated with this. This is simply more information for the same price to some extent. And so the barriers that there should be no incremental barriers whatsoever. It's just incremental information. Physicians now can give a quantification of risk to 100% of patients, or close to 100%, rather than what was historically probably 10% of patients.
That's quite the benefit.
Quite a benefit.
A few words, a summary, conclusion, what this means for patients or doctors watching this.
I think for both patients, clinicians, and experts in genetics, the launch, the development, the validation, and the launch of the risk score enhancement to myRisk really is probably one of the most significant advances in hereditary cancer assessment for many, many years. We were privileged to participate in the identification of BRCA1 and BRCA2 2 decades ago now. We've taken the lead on the development and commercialization of the most popular and widely used hereditary cancer panel in the United States with myRisk, and now we're able to see 100% of patients who are at elevated risk of breast cancer based on their family history have information on their risk quantified using both the 11 breast cancer genes that are on myRisk, but also now with the enhancement that risk score brings to the table. So it's an exciting time for Myriad Genetics, but it's an exciting time for patients who are concerned, or women who have a concern about their breast cancer risk as well.